We continue our coverage on one of our top stories where the quest to find the cause of the fire that broke out at Tembisa Hospital's accident emergency unit last night, of course, continues. We are joined by, we also saw Gauteng Health MEC Nomantu-Ralehoko saying that while the accident and emergency unit remains closed, other hospital services do continue to operate. But we're joined now by the City of Ekurhuleni's Mayor, Mayor Nkosindiphile Xhakaza. Mr. Mayor, good evening to you. Thank you so much for joining us. Concerning, I know that you visited the hospital. How would you characterize what it was that you saw was the state of that unit at the hospital?
No, thank you very much for having us. We, as you know, that the fire broke out, late early evening on Saturday. We actually responded as a city leadership to actually go and actually support all the efforts there, and we did, give update to our communities and the public about, our responsive, the teams, the disaster management team from the city of Ekurhuleni, the Gauteng emergency management services, including, some of the service, private providers who actually, responded to that incident. We did confirm that a joint operation center was set up and that everything was actually managed. And indeed, today we went again, to the hospital and accompanied the MMC of Health, who's also the acting premier, and indeed we can confirm that everything it is under control. And what we're happy with is that many of our communities who've got their loved ones, receiving care at the hospital, managed to actually visit in their numbers. From 2 o'clock, you could actually see, hundreds in their numbers actually going there to actually see for themselves that their loved ones are actually in good care. I must say that the area that has been affected by fire has been cordoned off. And the police are actually, have taken charge of the space to actually produce the necessary reports. We've done the walkabouts, some of the inspection, including, importantly, what is the business continuity plan? What is the alternative in case of this disaster? And we've seen some of the great work that the teams they've actually put up to ensure that, if everything permits in the next 24 hours, they should have the alternative site that has been identified, fully operational. Of course, there are some dependencies in terms of some of the areas that are still pending an investigation. But what we can confirm is that the hospital is operational, except the accident and emergency section, what we call casualty section, and currently the hospital is in terms of operations is on the divert mode. I think that's a word that they use. What it actually means is that they are not able to take up the numbers that are actually brought to the hospital. The patients that are brought to the hospital through, ambulances, they're able to, divert them, which is about 90% of what they're able to take. They're able to divert them to other hospitals, and those that are walk-in, they should be able to, attend to them. And I think that is what our communities want to know. Are they able to get services, emergency services, as they, go to the Tembisa Hospital as we speak? Yeah,
I think that what's also interesting is you've got, at the moment you say you're going to divert other patients to other spaces, but then there's the question around some of the infrastructural work that does need to be done. Some of the concerns that you have around what would have led to this fire, Mayor?
Yeah, at this stage, as I've indicated, there is teams that are investigating, some of the forensic teams that are looking, composed of the SAPS, the fire department of Ekurhuleni is part of that team. And at this stage, it will be speculation. We rather await the official, report that will be given in due course from the Department of Health.
Yeah, and no one was hurt.
That is the comfort that we want to bring to our communities, that all, the patients, I mean, there's an account with a statement that has been issued by the Department of Health of about 81 patients that were, in the accident and emergency unit that caught up fire, and all of them, they've actually been accounted for.
Okay, just the communication that needs to be given to communities in and around the area, of course, and how you're going about it. I know that being here with us as well does certainly help to let them know that those that want to use the hospital may very well be diverted. Other platforms that you're using to engage, particularly the community, a community such as Tembisa, for instance.
Yeah, I mean, today we were there, as myself as a mayor of Tembisa. I'm also a resident. As a mayor of Ekurhuleni, I'm also a resident of Tembisa. The councillors, the ward councillor of that ward where the hospital is, including the leadership of councillors, because, Tembisa is broken down into two for better coordination of government. They're also part of the team, the board of the hospital, which is composed of leadership from communities. They were also part of some of the inspection and the activities that we're doing. And we've ensured that the message that comes through from the department or the office of the MEC is communicated to our communities, and that our communities, they know what needs to be done. And I must say that Tembisa is a big hospital, is a tertiary hospital with services, communities beyond the section of, the township of Tembisa. Kempton Park, go as far as Deep Sloot, go as far as certain areas in Pretoria. But immediately, it is the community of Tembisa. And we have also some of the secondary institutions, like the clinics that are owned by the province, like a Sangweni clinic, which is able to offer, some of the services, and it's also used, in this business continuity measures as an alternative, because it's got some capacity to actually service our communities. So that type of investment goes a long way to actually ensure that it elevate the pressure. But we must say our worry is that there is going to be a lot of pressure. The good thing is that, what was 81 patients in the emergency section is within the capacity of what Tembisa is able to carry, because we're told it's able to carry up to, at full maximum, about 100 patients, and that 81 at a time, given that it is Easter, many people are outside of the province, but as they flock in the next 2 days, safe, because it's not a weekend. As they come back, the measures that have actually been put in place, they should be able to manage the situation.
Yeah. Mr. Mayor, we really do appreciate your time. Thank you so much for speaking to us and bringing us up to speed with the work that's being done there. Ekurhuleni Mayor Nkosindiphile Xhakaza speaking to us, of course, so giving us an update on work being done after that fire at the accident and emergency unit at Tembisa Hospital. We're going to take a short break. More news on the other side. Stay with us.